Namaste. I am Dr. Amit Tiwari from Manipal Hospital, Gurgaon. Before starting today's topic, I like to say, ladies, please excuse because the topic which I am going to talk today is basically exclusively for men's health. Today I am going to talk about penile implant. I'll just give you an overview of what exactly penile implant is and who actually needs it. Now, penile implant is an artificial implant which we put in the penis to achieve erection which is good enough for one's penetration. Now, there's a different types of penile implant. The basic one which we prescribe is a 3-piece implant in which we have an artificial button which we put in the scrotum, reservoir which we normally put in beside the bladder, and 2 tubes which we normally insert in the penis on both sides. Now, who actually needs an implant? This is basically for people who are eager enough to have active sexual life even at elderly age. Now, patients with diabetes, heart disease, coronary artery disease usually have atherosclerosis even in penile arteries, which prevents them to have an adequate erection at age. Now, other than that, there are few entities which normally people are not aware of. One is Peyronie's disease. It is actually a calcification which is there in the penis. And when the penis becomes erect, this calcification causes the penis to deviate when it's getting erect. Now, if the deviation is severe, the penis might not be able to achieve an adequate invagination into the vagina. Now, in these cases, the final treatment option remains penile implant. There is another entity called penile fracture. Yes, fracture in a place in a body which doesn't have bones. Now, fracture happens in the penis whenever the penis is erect and it gets bent. Now, whenever it gets bent, there is a crack in the lining of the penis which causes hematoma, which causes bleeding, which might cause sudden tumescence, that is the penis which in erect loses its erection, and in severe cases the patients may have swelling around the penis. Patients usually also hear a popping sound when this happens. Now, when an erect penis, if the person is undergoing too vigorous a sexual activity, or he falls on an erect penis, or any sort of trauma which is there in an erect penis causing it to bend, this penile fracture normally occurs. Penile fracture is normally repaired as soon as possible, but if there is a delay of 24 to 48 hours, the only prognosis the patient has to achieve an adequate erection is penile implant, because it has a very poor erection rate following the injury. There are under entities called priapism. Priapism is erection of the penis for more than 44 hours, which if not treated at an adequate time, the patient loses his erection. Now, all these entities, the end result is refractory erectile dysfunction. Now, why refractory? Refractory because the patient does not benefit from any medications. Intrapenile injections are usually not helpful, or even the vacuum erection devices which are being propagated doesn't help. So the final treatment option is penile implant. Now, as you know, every surgery has its complications, and so does penile implant. The implant rate, the failure rate is approximately 15% in the long run as in 5 to 10 years. The implant may need correction. However, the patient and the partner satisfaction rates achieve up to 90-95%. Hence, the penile implant gives a very adequate erection. And most importantly, it is an on-demand erection. Whenever the patient feels like having a sex, he can just press a button and the penis will become erect. The duration of the erection also can be controlled by the patient. The only myth which I want to address with the penile implant is penile implant does not increase the length of the penis. It has been falsely assumed by patients that after implant they will get a longer and thicker penis, but it doesn't happen. The length of the erect penis after the implant is actually a bit smaller than what he actually used to have. So any queries, any doubts which you have regarding erectile dysfunction, do contact us. We'll give you the best possible option you have. Thank you.